Hello, my name is Elizabeth Price. I am an LCSW with over 13 years experience in the field of social work. I'm also an exam prep coach with AATBS, where I've helped coach hundreds of students pass their licensure exam with ASWB in both the master's and clinical levels. I know that studying for this exam can be both stressful and overwhelming. So today we're going to learn how to break down some questions, learning some effective strategies. So let's get started. You will see two types of questions found on the exam. You'll see both recall and application. I always say that recall questions are the type that you either know or you don't. These questions are going to address a broad range of information, such as mandated laws, facts, theories, concepts, ethical requirements. And the primary skill is going to be to assess your ability to retrieve information from long-term memory. There are not going to be many of these on the exam. The majority is going to be application type questions. But you'll notice as we review a question in just a second that even though these types of recall questions are asked, and I explained that you either need to know it or you don't, there is still a degree of application needed. So the majority of questions found on the exam are application type questions, those case scenario type vignette type questions. These questions are going to require you to use your knowledge to recognize an example of a term or a concept, to make a judgment or decision, or decide the best intervention. We're going to break down these types of questions in learning how to identify the best answer of the options given. And I know that sometimes it can seem that the questions are trying to trick us. That is not the intention. These questions are trying to make us assess our ability to think critically through a multiple choice exam. It is different than most multiple choice exams we've experienced in the past, but thinking critically makes us great clinicians. And I do believe that there's two equal components to being successful for this exam, and that is knowing our content, whether it's at clinical level or master's level, but then also knowing how to answer these questions in the weird ways in which the questions are asked. And so that's where we're going to break down some strategies today and learn how to apply them to questions that might be similar, including the ones that are found on the exam. A reminder before we get started as well is that you won't see these exact same questions on the exam, so there's going to be no need to memorize. Instead, I want you to focus on the strategies and the themes, and then you can then go apply those strategies to other questions, even if the wording or the clinical context is different. So our first example here is a recall question. And again, I described these as you either know it or you don't, but you'll see how there's still a degree of application needed. A mother brings her 15-year-old daughter to a social worker to have her assessed for depression. Her daughter has started wearing black and has dyed her blonde hair hot pink. The girl denies she's depressed and says that all her friends dress the way she does. According to Erik Erikson's stages of psychosocial development, which crisis is the client experiencing? So you have here industry versus inferiority, autonomy versus shame and doubt, identity versus role confusion, and intimacy versus isolation. So even though I described again as that these are the ones that you either know or don't, let's assume for a second that we don't know this answer. In those situations, we want to at least use strategies such as deductive reasoning or something similar to where we're not getting in the habit of just saying, oh, we don't know this question, let's just simply check off C, for example. We want to at least see if there's some that we can rule out or just try to figure out and eliminate before choosing our best answer. So here, with knowing that, okay, she's a 15-year-old adolescent, so more than likely, let's say I'm not familiar with these stages, I could probably rule out that she is not likely to be in the intimacy versus isolation stage. That would seem like where you're trying to develop romantic relationships, intimacy, that type of thing. So more than likely that would not be a stage that would include a 15-year-old girl. So I'm going to rule that one out. So that automatically increases my chances of getting this one correct by just even eliminating one. And then let's say that I am a little familiar with Erik Erikson stages, to where then I can go on and say here, okay, industry. That's mastering new concepts and new skills. So that would be more appropriate for a school-age child. Autonomy versus shame and doubt. Autonomy is that type of thinking of, oh, I can do it myself. So that's more that toddler type stage. And then feeling shameful if they're not able to do something themselves. So if I'm looking at that then, and then that leaves identity versus role confusion. And we know that saying of where teenagers are trying to find themselves or don't know who they are quite yet. So that might make a little more sense then for a 15-year-old girl to maybe be experiencing that different psychosocial crisis there. Identity versus role confusion. Okay, so you see how even though not being just 100% familiar with Erik Erikson stages, I was still able to eliminate one automatically. But then even being somewhat familiar was able to kind of go through and just use a thought process to slowly eliminate the others. So the correct answer is C. And once you know these stages beyond memorization, you will recognize and understand the struggles most common during the teenage years. Although this is considered a recall question, you can see how application is still involved. You still have to go a degree further than just being able to identify what it is, but actually know the stages.